I'm at Healthline today with Linda Matthews. She's a nurse here with the Regina Capel Health Region, and we're talking about, well, first of all, the differences between influenza and the flu. I always thought they were the same thing. Perhaps you did too, but you tell me they're different. What are the differences?
Totally different. Well, not totally different. Influenza, the symptoms of influenza would be high fevers, headaches, body aches. People get a dry cough, poor appetite, generally feel just achy all over and quite sick, but no vomiting or diarrhea.
How do I know which one I've got, basically? I'm vomiting diarrhea with the flu.
Right. The flu that we're all talking about, that the whole province has right now, is vomiting, diarrhea. You might have a fever with that as well. You don't always, but you can have a fever, quite bad abdominal pains, cramping that comes and goes. Again, very poor appetite, weak, but it's the flu that we always talk about is vomiting and diarrhea.
Right. Oh, I've been there. What do I do for it? Should I be taking over-the-counter medication, any prescription drugs? Do you recommend that?
Well, we recommend some over-the-counter. If you have a fever, we recommend Tylenol, Motrin, Advil to help control the fever. For the diarrhea, we do recommend, for small children not. We don't recommend anything. It basically has to work its way through their system. But for adults, we do recommend Imodium and Pepto-Bismol for diarrhea. So, if you have diarrhea, try those. And in both cases, lots of rest. Fluids. I mean, you need to, and fluids, when you're vomiting, we recommend you take fluids all the way through the vomiting. Like some people say, no, you wait till you're done. No, we recommend keeping hydrated all through. So taking sips, like you use chicken broth, diluted fruit juices, pop that's flat, Jello, the oral rehydration solutions like Gastrolite for children, it's Pedialyte. So those, but just sips, keep sipping constantly.
What about water?
Well, water doesn't have any electrolytes in it, so you're not replacing any of the electrolytes that you're losing with vomiting and diarrhea.
The most important aspect of this conversation probably is preventing it in the first place. So what is the number one thing people should do to prevent getting it in the first place?
Wash your hands. Wash your hands. Wash your hands. Wash your hands and wash your hands.
There you go.
Especially when you're out in public, like if you're out working or around a school, like doorknobs, railings, any place people touch a lot. Of course, I mean, if you swab those, you'd probably be shocked at what you could grow in there. So we recommend just wash your hands a lot. Like certainly wash your hands before you eat. At home, like if you get the flu in your home and it's, everybody's vomiting and diarrhea, you can disinfect your home with 1 part bleach, 9 parts water. So again, all places that you'd, light plates, door handles, counters where kids, any place where people are touching. Disinfect your bathroom really good with that. Telephones, anything that you might think that people are touching a lot.
There you go. An ounce of prevention is worth the pound of cure. So if you follow Linda's advice, you'll stay healthy and happy. Thank you, Linda.
You're welcome.
And good health to you.